Okay, we're live. Hello, it's Bill, the knee pain guru. Today, we're going to go over some questions that have been sent in on the YouTube channel over the past, well, probably since the weekend. Have been busy with some other things, helping clients. So we're going to dig into them right now. First question here is from Giovanni Sanchez. This was regarding bone on bone and staring down a knee replacement video that I had done a few years ago. I think you're absolutely correct. I think you are, because I have bone on bone arthritis or the left knee and lost weight. I felt comfort. If you're overweight, lose weight, man. If you could get an amniotic stem cell therapy injection, get that. Do not do PRP. Do not do where they do bone marrow amniotic. What's going on? Overweight, because it just means you're just too fat. You're just too fat, man. I mean, too fat. You need to lose more weight. At my age, I'm 5'6", and I need to lose weight. I'm 210. I was 232, went down to 210. I felt better, got an amniotic stem cell shot, and I need to get down to 180. I bet you'd be okay. Thanks for your help, sir. I appreciate it. Hope you're great. God bless. Okay. Let's talk about bone on bone and being overweight. It is true that for every pound of weight you lose, it reduces the force on the knee joint by 4 pounds. What do they mean by that? Every time you take a step, there is 4 times the force that goes into stepping on that knee. However, think about this. There are fat people that don't have knee pain. So it's not a function of the overweight piece that is causing the pattern in your body that is causing the issue with the knee. This is important to understand. We want to get to the root cause. So if we're talking about the root cause, it means it's going to be across the board on everybody. Fat people, there are fat people that don't have knee pain. So it's not the root cause. Because if it was true, then every fat person would have knee pain. We have to zoom out. We have to look at it with an understanding, a deeper understanding of what's going on in the neurology of the body. That's the source of the pain. Irritation of nerves in the joint. It doesn't mean losing weight isn't going to help your knees feel better. It's just not the source of the pain. And we can get you out of pain faster instead of hoping we're going to get you from 232 pounds all the way down to 180. It's a lot of weight to lose. And that's a lot of pain to be in for a long period of time, and discipline yourself to finally get to a place where your knees don't hurt. We have to think about the end goal that we want and the strategy that we want to use to get you there. So that's my take on that. And I see we have a few people here. If you have questions, please enter those in the live chat. I will address those. So that was from Giovanni Sanchez. The next question is from Dmitry Pravednov. Okay, it says, this was regarding how to eliminate knee stiffness. And he writes, letting people know about the shot in the knee that complications can cause. Yes, I had inflammation now. I have more problems. I lost feeling and my knee is cracking. When walking, I'm off balance. Yes, the off balance piece happens because the body is protecting itself from experiencing what's going on in the knee. Your unawareness or your avoidance of looking at how the pain in the knee affects the tension in the rest of the body does not exclude you from the ramifications of that unawareness. This is important. Your knee is holding a tension pattern. It's there. It's giving you a message, a signal. It is communicating with you in some way to let you know something needs to be changed in what's going on with your knee. just like the check engine light that comes on your car. It's telling you the oil needs to be changed, the battery needs to be checked, the engine needs to be checked, you need to take it into a mechanic. Something is going on. Make sense? If it makes sense, give this video a thumbs up, like and subscribe to the channel, turn on notifications for future videos. I'm only talking common sense here in terms of looking at the body, looking how the body is responding to what's going on. When you address these issues, you need to put in a little bit of effort, you get big results. And you're not going to be running around on the hamster wheel wondering why your knee's hurting or what's going on or what you need to do next. When you calm your nervous system down, the clarity presents itself. The understanding, your own knowledge and wisdom about what your body needs is evident. And then you make those little tweaks and adjustments in your day, and it makes a big difference. So, cortisone shots at the very best are a Band-Aid of what's going on. They'll numb the pain for a little while. They're not addressing the underlying pattern. And there's lots of people that get the cortisone shots and they can only get a series of 3 because after that, the doctors can't give you anymore or the insurance runs out. So if you want to use a cortisone shot as a short-term strategy while developing a long-term strategy to get your knee out of pain so the pain doesn't come back, or you know what to do when the pain comes back, then now we're talking. Now we have something that's sustainable, that's holistic, that's natural in order to get you to where you want to be. So you aren't a cripple limping around all the time and whining about your knees. Okay, if you got questions, type those in the live chat. Let's see. Now we're going to go to the next question. And this is a series of 3. It was sent in by the same person. His name is Asherbad. And let's see, he writes, if you don't mind, can I send you an email ID or anything of that such so I can write you and send some clinical reports? You can. However, here's the deal. Clinical reports doesn't tell me what's going on. Where are you? Clinical reports, X-ray, CT scans, MRIs, don't tell me what's going on with your knee right now. The pain that you have in your knee right now. Understand that those pictures, those reports are from the past. They're good for one thing in terms of our work together. They're good to determine if something is broken or torn in the knee. That's it. If nothing is broken or torn in the knee, then the only thing we're talking about is nerve irritation. And the only thing we need to focus on in order to get you the results that you want is getting the pressure off of the nerves in the knee that are causing the pain. We get the pressure off of the nerves in the knee and you get relief. And you can actually get relief faster than it would take for you to upload those pictures to an email and send it to me and for me to read it and look at it. Now, if you want to do all of that, that's fine. However, my time is valuable. I'm just being honest with you. There's a lot of people that are suffering with pain, and my focus is going to be with those people that want to work with getting the relief in their pain now. The coaching programs that I have available, the private coaching clients that I work with are working to get the results now, today. We're not talking about maybe you'll see something next week, next month, next year. We're talking about getting the pressure off of the nerves right now that are causing the pain so you get a different experience, whatever that experience is. In the process of me working with you or you working in one of my programs is getting you to a place to get the results that you want. That's just how it works. So you're welcome to send me information. There, you can go on the kneepainguru.com website. There is a link to book an appointment with me, and I'll be absolutely happy to go over whatever you would like to go over with. We could do that. If you like the video, give it a thumbs up. Like and subscribe to the channel. Turn on notifications for future videos. Let's see. Okay, second question from Asherbad is, I don't know, but I guess I'm asking on public domain would be good so that many more people like me would be benefited. I have plenty of case studies. I've been doing this for 12 years online. I got it dialed in. For those that want more information as to how to get help, go to my website, thekneepainguru.com. You can head on over there. There's lots of people getting benefited going to that website. And his last question, but I would also like to describe you my issue right from the beginning, and it's not that short to tell in the comments section. And this is consequently what happens. People suffering with knee pain want to share with me everything that's happened to them ever since they fell off a swing when they were 2. And that's great. You know, I get it. I get it. Like, doctors don't listen to what you're saying. Physical therapists ignore what you're frustrated with. And I get that. And I understand. And what I want to respect is your time as well as mine. So if you want to go into all of that, if you want to tell me all of the things that have happened over the years, and a lot of times people have been suffering for decades with what's going on with their knee, then absolutely book a time. I'm happy to sit down and talk with you about it. However, here's where we're at. There's limited amount of time, and what we put our time, energy, and effort towards directly results in how our life looks, how effective we are at getting rid of knee pain, getting rid of pain, moving forward in the direction that you want to create the things in your life. And the more you spend time focusing on things that aren't going to move you forward, well, you're going to get more of that being stuck in those places that you're stuck in. So that's my take. Okay. Wanda, hey, how are you? I still tell stories about you. I learned a lot from our work together. It says, hey, Bill, I just want to thank you for the invaluable help you provided me after I had surgery for a torn meniscus. Grateful every day. God bless. Thank you, Wanda. Cool. If you liked the video, give it a thumbs up. Like and subscribe to the channel, Knee Pain Guru YouTube channel. Turn on notifications for future videos. Okay. Next question here is from Todd Shaw. I have a meniscus tear in my right knee. I had 2 years in my left knee, rehabbed my left knee, and in time my left knee no longer hurts. They recommend surgery for the left knee. Now they recommend surgery for the right knee. Should I deal with the pain and try to rehab it myself? Todd, you're limiting yourself as far as the questions that you're asking. Should you deal with the pain or try to rehab it yourself? There's a way better question to ask. How can you get out of pain? How can you get out of pain? Rehabbing it yourself. I mean, that's I have no idea what your experience is as far as rehabbing. So I mean, there's that place where when we ask better questions, we get better answers. You ask poor questions, well, the options in the answering of those questions leave you kind of stuck. So there's the ability to rehabbing it yourself, getting it out of pain. There's the ability of getting help with rehab. I don't know the situation. You have a meniscus tear. What is the degree of tear? What is the direction of the tear? How often does it hurt? There's a lot of information that needs to be brought in the room, so to speak, so we have a better, more of an educated response as far as moving forward. So we gotta look at the questions that we're asking to get you the results that you want. And then the other thing is, if they do surgery, will I still have pain afterwards? You're essentially asking me to predict the future. I don't know. Like, I literally don't know. And neither do the doctors, because there's some people that have surgery and they're completely out of pain afterwards. There's some people that have surgery and the knee pain is worse. So which one are you going to be? Difficult to say. Are you going to be disciplined enough to allow your knee to heal? Because surgery is a trauma to the joint. Are you going to do the right therapy? Are you going to show up to therapy? Are you going to change your diet? Are you going to drink enough water? Are you going to use the supplements that you need? Are you going to change the patterns in both your mind and in your body that created the meniscus tears to begin with? You can see how this just isn't like this isolated thing. In looking at what's going on with your knee and being able to predict, there's just too many variables with it. So we got to look at it from a place of what is the end result that you want, and then backtrack it from there to where you're at, so we could begin to make an educated evolution of you to a place where you no longer have pain in your knee, in your body. Okay. Wanda was the only one that shared on the live chat. Not a big deal. If you want to know what to do as far as like the next step, head on over to the kneepainguru.com website. Do I have that? Yes. The Knee Pain Guru website, the kneepainguru.com website. I'll drop this in the live chat. You can get more information. There's a video on the homepage. You could watch that video, follow it through to my group coaching program, which is called Knee Club, where I work with clients twice a week in group conference calls. Also has a private Facebook group attached to it. And that will give you the exact homework to do. Watch the videos, work on this part of your knee that's causing the pain, create the comfort in your knee in that point to teach you. It shows you how to do the changing of the neurological signaling that will give you a different experience on the other side of that. And we look at all the elements that go into getting you to a place from a holic. Nancy Hustleman. Hi, Bill. What is a good type of potassium to take? Too vague of a question. Take the kind that works for you. I focus on the physical body and the neurological signaling. And it's based on what's going on with your knee right now. That would be a question you'd ask your doctor, you'd ask a naturopath, you would ask somebody who deals with supplements on a daily basis. I keep things super simple. Keeping it very simple allows us to focus on what's going to give you the results right now in your knee. Changing the neurological signaling, getting the pressure off of the nerves in the knee that are causing the pain, is going to be your fastest way out of pain. You could take potassium, that who knows what's going on with there. I don't know what's happening with your knee. I don't know what other stuff that's going on with your knee. Like, do you have arthritis? Have you had surgery? Are you just looking at pain? Has it been it was an injury or an accident? Did this come on gradually? we have to look at those other factors to understand the bigger picture of what we're dealing with. And it's important to understand that when you're in chronic pain, when you've experienced pain for an extended period of time, for weeks, months, years, even decades, I've worked with clients for decades, pain changes how you think. Pain changes how you move. Pain changes how you feel. And understand that in that space, you're not thinking clearly. You're not moving smoothly, and your emotions are muddled in there to try to figure out, what do you do? The idea is you get the nervous system to calm down by creating comfort in the area of the knee that hurts the most. When you begin doing that, you feel relief. Your nervous system drops down. You can breathe better. You can sleep better. Your body can begin to recover better. Then you'll know if the potassium that you're taking is actually helping or not. Would you take the potassium if your knee didn't hurt? Would you go to the doctor if your knee didn't hurt and you had full range of motion in your knee? Most clients that I asked that question to would say no. So you have to look at the outcome that you want instead of like a la carting or piecemealing what you're doing as like throwing it against the wall and seeing what sticks. Because if it doesn't stick, guess what? You're in the same place again. You're on that hamster wheel trying to figure out how you can get out of pain so you can go back and living your life and walking without limping or going up and down stairs without pain. Make sense? If it makes sense, give the video a thumbs up, like and subscribe to the channel, turn on notifications for future videos. You want to know the next step, head on over to the kneepainguru.com website. I'll have it in the replay. I'll have it at the end of the video. And if you want to know, like, get help, we have our call today. We have our Knee Club call at 5 p.m. Eastern time. 5 p.m. Eastern time on Thursday. We have the calls on Mondays at 1:30 p.m. Eastern time. So you can take advantage of that. That's in the products and programs section on the website. You can check that out. I mean, the kneepainguru.com website. If you have questions, you're watching the replay, please enter those in as I use these for future videos. So, okay, I need to get some water. Thank you all for being here and allowing me to share. You may not like what I have to say, and that's okay, because sometimes in order to get you to change, you got to get shaken up a little bit. Anyways, okay. Thank you all. I will talk to you soon. Have a great one. Bye-bye.